Hi everyone, welcome to the third episode of the Blood Lecture Series, and today we're going to talk about blood donation from collection to clinical use. Now, blood donation is one of the most efficient and low-cost medical interventions that are available to healthcare systems globally today. And a standard whole blood donation approximately collects around 470 milliliters of blood. And upon arrival at a blood center, the unit undergoes centrifugal separation into red blood cells, plasma, and platelets, and each have their own specific clinical applications. Now, red blood cells are transfused in trauma, anemia, and surgical blood loss. On the other hand, plasma is generally used for patients undergoing liver failure or even coagulation disorders or severe burns. Platelets are critical for patients that are undergoing mainly chemotherapy. Each unit is also subjected to stringent testing for transfusion-related infections, including HIV, hepatitis B and C, and syphilis. And then units, these blood packets are essentially labeled, cross-matched, and then entered into the national or the regional databases. Notably, red blood cells can be refrigerated for up to 42 days. On the other hand, plasmas can be frozen approximately and stored for 1 year. Platelets, however, they have a really short shelf life of approximately 5 to 7 days, and they also require continuous agitation at room temperature, so that makes keeping them very difficult in comparison to other components of blood. But still, thanks to this system, one donation can benefit up to 3 recipients, so do visit the blood donation center that's the closest to you and donate blood.